First off, we're going to be talking with Dr. Lena Malik, who is a pediatrician at the Romy Lane Pediatric Group in Salinas. And we're going to be talking about some of those childhood ailments that really scare us as parents, and sometimes we're not quite sure when is it appropriate to bring our child into the pediatrician, or when we can take matters into our own hands and be empowered at home and knowing that we can take care of our kids just fine at home. So today we're going to be talking specifically about fever. And there is so much information that we could probably talk for a whole hour just about fever. We might get into some other things too, but without any further delay, I wanted to introduce you to Dr. Lena Malik. Hi, Dr. Lena. Hi. Thanks so much for taking the time out of your busy day. I know this is flu season.
It sure is.
So it was a big deal for you to come and talk to us today. So thank you for being here.
No problem.
Tell us a little bit before we talk specifically about fever. Everybody's going to want to know a little bit about you and why you decided to actually become a pediatrician. So can you tell us a little bit about your story?
So my story is a little bit long and complicated, actually.
It's okay, we got time.
I've always known that I liked science and, biology in particular. But when I first went to college, I was doing biomedical engineering.
Whoa, yeah, that's a big switch.
Completely different thing.
Yeah.
I worked in that for a little while and just decided I really was not happy with that. I needed more people contact. I wanted to see more variety of people and hopefully be a little more outgoing in my life. So I sort of tried to figure out where I was going to go from there. I ended up in nursing school. I thought about being a midwife for a while. I did a lot of sort of shuffling around between things.
Yeah.
In medical school, one of the things that they give you the opportunity to do is to look at all the different specialties. So I did OBGYN thinking that's what I was going to do, and was not as happy there as I was in pediatrics.
No, who knew?
Who knew? And, now looking back, I think that I've always loved kids. I've always had a real sort of strong attachment to kids, and I love their energy. I love how, just the way that they are, the way that they view life. All of it. And so, it does make sense now that I'm here, even if it didn't from the beginning.
Yeah. Now you know that you are you're exactly where you're supposed to be.
I really am, and I feel fabulous about being able to have found the thing that really is my thing.
I know. Oh, that's great. Well, I know that your patients have got to just absolutely love you, especially because you're happy to be where you're at right now. Yeah. And so you have a big practice on Romy Lane.
It's pretty big. There are only 4 doctors there, but I have many patients, so it's pretty busy. But we're located right across the street from the Salinas Valley Memorial Hospital, and that's where I have my privileges. So if people need to go to the hospital, that's where I admit them.
Very convenient.
Yeah.
Good. Good. So you have lots of kids coming in and out and through your office.
Oh, yeah.
And I'm sure that one of the biggest things that you see moms and dads bringing their kids in for is little Johnny or little Susie's got a fever.
Absolutely. I would say that out of the sick visits that come in, probably 75% of them, the very first thing the parent says is, he has fever.
And we automatically think that fever is dangerous.
Right, exactly.
Can you tell us a little bit about fever, like kind of the definition of what is a fever and why our body actually gets a fever, and why kids seem like they get fevers a lot more than adults?
And they do, in fact. So that's actually true. So the definition of fever really is any elevation of the normal body temperature.
And what's our normal body temperature supposed to be?
Right. So if you ask most people, they'll give you a number. They'll say 98.6. But really, as with anything with the body, it's not as accurate to say a number. It's more accurate to say a range.
Okay.
Right.
Good.
So it can be as low as 97.2. It can be as high as 100.4.
Really?
And that's still be considered
normal.
Right.
Okay.
So technically speaking, 100.5 or above is what a fever is.
Okay.
So if it's below that, there's some people who, it's sort of like having borderline high blood pressure. If you have a borderline temperature, you still might be feeling a little down or something might be going on, but it's not considered an actual fever.
Okay. Okay. Just maybe the body trying to give us a message of some sort, or working hard for some reason.
For some reason, exactly.
What is a normal, typical reason that the body will go into a fever?
Generally speaking, it's a tool that the body's immune system uses to fight off something that's foreign. So the vast majority of the time, that's a virus or a bacteria. There are some cases where the body will see something on itself that it sees as foreign, even though it's not. And that's what an autoimmune disease is, things like juvenile rheumatoid arthritis or lupus or things like that. So those types of things can give you a fever as well. But basically, your body, whatever's going on, your body is trying to fight something. And that's what a fever, that's the purpose of a fever, is to fight off some kind of an infection.
So it's really a natural reaction. It doesn't have to be a bad thing.
Right. Yeah, it's a tool that your body uses. It's, you know, your body is actually really good at what it does. That's another reason I love medicine, is because your body's awesome.
It's amazing.
But so, you know, it's doing this on purpose, and it's doing it to take care of this infection on its own. And most of the time, it can do that.
Really? So it doesn't need any help from us,
It doesn't, exactly.
Even from a kid? Even with a kid, with a child?
Even with a child, you know. The thing that I talk to my parents about in terms of fevers with children is that when you're an adult, you've been exposed to a lot of different things, and your immune system has built up a whole tool chest, right? When you're very young, you haven't done that yet. You just haven't been exposed to that many things. And so what'll happen is the one go-to thing they have is fever. So it might be just a little sniffles that an adult would not get a fever with, but if, a child will get a fever with that.
Because our body's really working hard to just take care of this naturally. And
it doesn't have the other tools yet.
Yeah.
But that's another thing to remember, is that when your child gets sick with some kind of little sniffles or little stomach bug or something like that, that's a learning process for the immune system. And so every time they get that, they're getting a little bit stronger with their immune system, and they're making it so that in the future, a couple years down the road, if they're exposed to that same thing again, they won't get it.
Awesome. We like that part.
Yeah.
So when a parent notices a fever in their child, like you mentioned, sometimes there's a range of normal. But how do we know when a fever is too high? What's considered, you know, kind of a danger point to where a parent might be taking their child's fever and think, you know, oh, this is getting a little too high now.
Right.
Yeah.
I get that question a lot.
Yeah.
And the actual answer to that is there is no number.
Really? There's no number?
There's no number. You know, children, again, just like they get fevers more often, they also tend to get higher fevers.
Okay.
And the height of the fever doesn't necessarily correlate with the severity of the disease.
Oh, really?
So it might be a 103 fever with a little sniffles. It might be a 100.8 fever with a huge pneumonia.
Wow.
You know, so it's not really, what I always tell parents is it's not really about the number on the thermometer. What it's about is how the child is looking otherwise. Are they having trouble with breathing? Are they throwing up so much they're getting dehydrated? You know, are they really very uncomfortable? Are they pulling at their ears? You know, is there some other thing going on that we need to look at that and say what's going on?
I see.
Apart from that, usually, you know, even within the realm of infectious diseases, right, the vast majority of what kids get are viruses.
Okay.
Right. And we can't really do a whole lot about viruses.
Unfortunately, for parents, sorry.
I know, right, exactly. But rest assured, that's okay. Your body can do it.
Yes.
You know, it's the kind of thing that, you know, we never, as parents, ever want to see our children uncomfortable. And, you know, we sort of look at them looking, you know, downtrodden and upset, and we just want to do something. But just trust the body, because the body will fix it for you.
Okay.
Usually with a virus, what you're going to see is a fever for the first 2 to 3 days.
Okay.
If the fever's lasting more than 4 days, 5 days, now you're starting to say, okay, well, that's not a typical virus. So that's another thing that would prompt me to say, yeah, go ahead and bring them in.
Okay. So more than like 4 to 5 days.
4 to 5 days.
Okay.
Yeah.
Now, what are some of the symptoms that you see maybe along with the fever that would kind of alarm you enough to call and bring your child in?
Well, you know, pulling at the ears,
Okay.
that would indicate that there might be some kind of ear infection, or if they're saying that their ear hurts a lot. Things like, you know, if you do have a bad pneumonia, what you're going to have is the kid is going to sort of be struggling to breathe, and you'll see the sort of, you know, this thing sucking in as they're breathing.
Yeah,
you know, that's always a bad sign.
Okay.
So I would definitely bring them
Labored
in
breathing,
for
yeah.
that.
Okay.
Getting dehydrated. I usually use the rule of thumb that I want to see at least 2 wet diapers or 2 times going to the bathroom in a day.
Oh.
If it's less than that, then they need IV fluids.
Oh, yeah, that's dangerous.
dehydration can be much more dangerous than most things.
Yeah.
So that would be definitely a warning sign.
So a wet diaper, or if a child is potty trained, at least going potty twice.
At least twice.
During like an 8-hour period?
Over a 24-hour
24-hour period,
yeah.
Really? Okay.
I would love it if they were going a lot more than that.
Yeah.
You know, normal is a lot more than
Sure.
that. But you're not, you know, you worry about the kidneys shutting down.
Yeah.
And that's not going to happen until it's very low.
Okay. Okay. So that's definitely something to pay attention to.
Yeah.
Body habits.
And then, and just, you know, just in general, particularly with the very little kids that can't tell you what's going on, if they're just acting not themselves, if they really just sort of look like they're really depleted and fussy and not consolable, I would bring them in for that too.
Okay.
Now, a lot of times a fever will give you that. You know, you will feel fussy with a fever. What I say about that is, you know, if it is a fever that's high enough that I would give medication, what you do is you give the medication when the fever goes down. If they seem like they're back to being okay, then that's fine.
Okay.
You know, if even without the fever they're still feeling real fussy and down, I would bring them in for that too.
Yeah. Okay. All right. So when you feel, so do you feel that it's appropriate for parents to be able to treat a fever on their own at home without having to bring the child in if none of these symptoms, if they're not having the labored breathing, they are not dehydrated to where they are having, you know, potty moments throughout the day.
Yes.
They're fussy, but they're not like completely apathetic, right?
Exactly.
Do you recommend that a parent gives something though to bring the fever down, or tell us about that?
Right. You know, it depends, and different people will sort of have different bars where they feel comfortable, right? The way I feel about it is that this is something that your body is doing on purpose. It is trying to help you out. And so if you can let it do that, then I would just let it do that.
Yeah.
You know, definitely if a child is sleeping, I would never wake a child up to give Tylenol or Motrin or something. You know, it's, you know, if they're comfortable, they're fine, then let them be. Let the body do its work.
Yeah.
You know? Usually, you know, and different kids will be different ways, and different parents will have different thresholds of what they're willing to tolerate, right? But usually I would say somewhere around 101 to 101.5 is when really it starts to get uncomfortable. The kids get headaches and they're fussy, and adults the same way. If it's at 101, 101.5, you know, usually, you know, you're feeling it, you're uncomfortable. And so when I talk about giving medication for fever, it's all about comfort care.
Okay.
You don't have to get the fever down. In fact, the fever is doing a good job for you.
Yeah.
So if you can let it do its thing, let it. But if you're very uncomfortable and you need some relief, then medicate with one of the fever reducers.
Okay. So, and I think that's really important advice, because for one, especially with a child, I would think that we'd want our immune system to function the way it's supposed to and not be told you're doing something wrong when you're actually doing what it needs to do, which is, you know, raising the temperature to kill off a virus or a bacteria.
It's activating your immune system,
So,
and the more it gets activated, the better immune system you have in the long run.
I love that. That's a really, really good point, because I think that so many parents just reach for a fever reducer, you know, the Motrin or the ibuprofen or what have you, the aspirin, at the very first sign of a fever, when maybe it's a good idea to let the body do what it needs to do. At least watchful waiting, right?
Absolutely. And I think that comes from a misconception that I hear a lot from my parents, which is that people feel that fever is dangerous. The most common thing that they think is that it can cause brain damage.
Yeah, that's a big one, or seizures, right?
Seizures, right. So what I'll say overall is that fever does not cause any problems with your brain. It's not going to cause any long-term brain damage. It's not going to fry your brain. You know, that's what I hear all the time. It's going to fry your brain. You know? So it's not going to fry your brain.
Okay.
There is such a thing as a febrile seizure. That is something that happens to children between 6 months and 6 years. About 10% of children will get a febrile seizure at some point in time in their childhood. But again,
10%.
I know,
That's a big number.
It's a lot higher than people realize.
Yeah.
You know, people come in and their kid had a seizure and they think they're the only one on the planet, and you're like, no, there's a lot. It happens a lot. It's okay.
But mostly between 6 months and 6 years.
6 months and 6 years, and it's because of a kind of a quirk in the way that your brain is developing. When you're first born, you have a whole bunch of connections, And as time goes on, certain connections get reinforced and certain ones sort of fall by the wayside, right? So by 6, you've got certain pathways that are pathways and certain things that have fallen by the wayside. Before that, you have all of these connections, and so if you have one little spark of something that happens in the brain, it cascades to everything else. So, and that can cause a seizure. But the thing to know about that is, as scary as it looks, and it does look very scary, again, it won't cause any permanent brain damage. It's not something, it's something that happens at that time, and then they're fine after. So, you know, and I completely understand when parents are freaked out by it. It's definitely very scary looking. Right, yeah. But it is okay.
Wow.
Of kids who get febrile seizures, about 1 in 3 will get a second one. And only about 1 in 3 of those will get a third, so you're down to a very small percentage of people.
Very good. Okay.
And it doesn't usually mean that you'll have seizures in the future, like epilepsy or anything like that. It's not. And it doesn't cause epilepsy. It doesn't cause any problems.
Okay, that's good. So the fever isn't causing it, and it's not going to cause any. If that does happen,
it's not going to cause.
It's not going to cause any permanent damage, and
Right.
it may only happen 1 to 2 times.
Yeah, exactly.
Okay.
And maybe twice. You know.
Ah, that's good. It's a relief to know. So we don't have to worry about fevers getting so high that it causes brain damage.
Right.
We do want to let a fever run its course if possible.
Right.
If possible.
Right.
And always watching and waiting and looking for other symptoms that are worrisome.
Right.
Sometimes is it okay for a parent to just call the clinic and kind of say, this is what I'm seeing before actually bringing them in?
Different clinics have different ways of dealing with that. We do have an LVN that takes those kind of calls. If it seems like it's something that's more complicated than what she's comfortable talking about, then they'll ask one of the doctors.
Okay.
But yeah, we're more than happy to do it that way instead of you know, making you come all the way in and take time off of work, you know, all the stuff.
Yeah, good. So you see this day in and day out.
Yes, lots and lots and lots.
So also then, when you do recommend, say, you send the parent home with a child and you do feel like it's a good idea at this point to bring the fever down, is there a particular over-the-counter medication that you recommend?
So there's 2 major ones, and it's acetaminophen, which is the generic for Tylenol, right, and ibuprofen, which is the generic for Advil or Motrin.
Okay.
Right? Aspirin, which I used to take when I was a kid, is not safe for children.
Okay.
So we're not supposed to give aspirin.
We're always given aspirin.
Right,
I can still practically taste it.
I know, and it tasted so good. That was probably like even worse because
crushed up in applesauce.
So
Yum.
we're not supposed to do that.
Okay, no aspirin.
So no aspirin,
okay,
right?
It's not joking matter.
It's either acetaminophen or ibuprofen.
Now tell us a little bit about, is it possible for parents to be indiscriminate about how much they're giving and maybe give too much? I'm not talking about like in one dose, but just maybe over the course of a cold, or just what is appropriate,
right?
Because it is still a chemical that you're putting in your child's body, right? And so are there repercussions from it in the long term?
Well, in the long term, there's not really if you're taking it properly.
Yeah, if you're taking it properly.
You can get some pretty bad liver damage if you're taking a higher dose than you're supposed to or more often in the day.
So even for children?
Even for children, yes. So that's, and that's something to be very aware of, because you'll have the infant formulation, you have the children's formulation, you have, you know, there's, do I do it with a teaspoon, do I do it with a dropper, do I, you know, there's a lot of sort of questions. And again, you know, I would just, if you're concerned or you're not sure, I would ask your pediatrician. Your pediatrician knows the doses off the top of their heads.
Yes, okay.
So we know those things, and we can definitely give you the right dosage. It's the kind of thing that you use it as long as you need it, but that being said, you know, if you're using it around the clock, then how do you know if you need it?
Yeah.
You know, so my feeling is the less medication you use, the better. My feeling is that you only do it when your body really, really needs it. So what I usually encourage my parents to do is to see if their kid looks uncomfortable, then go ahead and take the temperature. If the temperature is high and they want to give something, they can give it. If it's not, I would just leave them. You know, Tylenol doesn't help with cough. It just helps with fever.
Very good. Right? Thanks for telling us that.
Yes.
Yeah, because I know that, you know, I know that sometimes we get busy as parents, and I know that sometimes, not sometimes, all the time, we don't want to see our children suffering.
Right.
And if they're cranky or what have you. So we have to be careful not to just indiscriminately give Tylenol. Or,
you know, you just don't want to be giving it every 4 hours just because you're afraid the fever might come back.
Or just because your kid's cranky.
Or, right, exactly. You want to do it only if your child is uncomfortable and you really feel that they need some kind of help with that discomfort.
Okay.
You know.
And when a kid comes in to your office, like you said, generally you're looking at virus?
Almost all
the
viruses,
time.
yes.
So really antibiotics?
Antibiotics work against bacteria. They don't really work against viruses.
Yeah.
So, you know, in general, the flu virus is a little bit of a different thing because there are medications that can help that are just symptomatic. They don't kill the virus, but they can help. But pretty much other than that, it's all about rest, fluids, you know, humidifier in the room if you're having a stuffy nose or a cough.
Good. Let's talk about some of those tips. Yeah. Talk about some of those tips, those other natural things that you can do,
stuff
especially
you can do at home that you don't need me for.
Yeah. So humidifiers.
Not that I don't want people to need me.
Oh, you're always going to be needed. You're always needed.
So humidifier is great. It helps to break down the mucus and helps to make it a little bit more mobile so your body can get rid of it quicker.
Okay.
What they found in terms of cough is the cough syrups, and this is something that pediatricians have known for decades, but they don't work on kids. They don't work on kids at all. They were tested on adults. They found some benefit for adults, and they just sort of put it in a liquid form and made it smaller and gave it to
like
kids.
cherry and give it to kids.
And give it to kids.
But it doesn't work?
It's this, when they do the studies, it's the same as placebo.
What? Yes. We took all that Robitussin for nothing?
For nothing, right. But good news is they also tested it against honey, and honey actually works.
Imagine that.
So, you know, usually what Grandma says is a little always suspect to me, but the warm tea with honey in it, that actually makes a difference. That actually does help with the cough.
Helps with the cough. And I have to say, add a little lemon to that, and you get a little extra bonus there.
Yeah.
Yeah, exactly. They're just talking about, I just also was looking at an article today about garlic. And how effective garlic is to actually killing bacteria and viruses too. So there's you can put, if your kid will eat it, you can make soup, like a chicken soup, and put lots of crushed garlic into it. Yeah.
And garlic, when you cook it, is actually very sweet. So, you know, kids will, as long as it tastes good, they'll eat anything.
Yeah. So that chicken soup is actually a wonderful thing, you know, for a cold. And
it's got that, because it's warm, it's got that steam, and that's like a humidifier in your bowl.
Exactly. But we just don't need to be, we don't need to be turned into the cough syrup. That's a great point. I really didn't know that. And but
most people
aren't they're still I was going to say, they're still marketing the stuff.
They're still selling them. Yeah.
Selling it, but it's not effective for kids.
It's not effective. Yeah. It's not effective. They're still selling it.
We don't have to go there during this program.
Exactly.
But you know what? Someday we will. Okay. Someday we will, not today. Okay. So now we know. You can save money. You don't have to be purchasing cough syrup for your kids. Honey. And honey only after age 1, right?
Yeah.
That's
what they still recommend. You know, I'll tell you, you know, my feeling about that is that the reason that they wanted us to wait was because when you jar your own, there's the possibility of botulism.
Oh, and just when you jar your own.
And so the store-bought stuff, I don't think it really.
It probably is pasteurized.
Yeah,
okay, good. So honey and lemon, and a teaspoon of honey is probably better than a teaspoon of cough syrup.
Yes.
And we need to know that we can let the fever run its course as long as, you know, the child is responding well enough, you know, for a sick kid, and it doesn't get too high, and everything else, you know, all the other symptoms appear to be somewhat normal.
That's right.
Yeah,
exactly.
No labored breathing, no listlessness, no dehydration.
Right.
Wow, you cleared up a lot for parents today. A lot for parents today. This was big, and we didn't even talk about the flu.
Right.
And we don't really have time to talk about the flu. Okay. But I'll have you come back and we can talk about the flu. Because I know your clinic right now is just inundated. But again, the flu is a virus, so an antibiotic generally isn't going to work.
Right.
We do have to keep in mind all the things that you just mentioned about, you know, fever and cough syrup.
Right.
And that is really, really very applicable to the flu.
It is. And it's just all about rest and fluids and just be kind to your body.
Yeah. Yeah, good. Well, tell us a little bit now. If people want to come and find you because you are the doctor in the know, Dr. Lena Malik, pediatrician at Romy Lane Pediatric Group. Can you tell us your address and phone number?
So we are at 610 East Romy Lane, which is right across the street from the Salinas Valley Memorial Hospital. The phone number there is area code 831-422-9001. We do also have a website, which is romylanepediatrics.com. So, yeah, and we're all, there's one doctor there who is quite a bit older, and so he's not taking new patients right now, but the other 3 of us are all taking new patients.
Wonderful.
So we're totally happy to have you.
Wonderful. Wonderful. Thank you so much for being here, clearing up these misconceptions about cough and about fever, and we're happy to know that our kids can't get brain damage if their fever gets too high. And that was excellent tip about the cough syrup.
Yes.
Thank you. Thank you so much for being here, Dr. Lena. It was wonderful to have you. And I have to say, Dr. Lena is also a very amazing Zumba instructor. She's my colleague in Zumba at Fitness Unlimited right here on Garden Road, so come and check her out sometime. But do please give her clinic a call, Romy Lane Pediatric Group, at 422-9001, or go to romylanepediatrics.com to find out more about Dr. Lena and her clinic in Salinas. And I hope that you really took notes today during this wonderful presentation. Dr. Lena will be back with us in the future. So thank you again so much.
Thank you.
And don't go anywhere because